Okay, let's get started. So good afternoon and welcome. This is Born's RSV webinar for the 2025-2026 season, and we are thrilled to have you here. Whether you're sipping coffee, juggling tasks, or just settling in, thanks for making the time to join us today. We've got a lot of great information lined up to help make this RSV season smoother, smarter, and more successful for everyone involved, so let's jump right in. We have a couple of quick housekeeping notes. So your cameras and mics are turned off, that you may have noticed, and chat is disabled. So there's no need to worry about background noise or any surprise cameos. You can use the Q&A feature to ask questions anytime during the presentation. We do have a team behind the scenes answering as we go. And we'll also have some time at the end for open discussion and sharing. To find the Q&A, just click the Q&A tab at the top of your screen, and it works on Teams for desktop, mobile, and web versions, depending on how you're accessing this webinar. So we've got a full agenda ahead, including a deep dive into last year's data. Yes, there will be charts, but we promise they're the kind that tell a story and not just numbers in boxes. So we'll look at what worked, what didn't, and what we can learn moving forward. But we also want to hear from you. So we've carved out some time for a Q&A and strategy sharing session. This is a chance to ask questions, share some wins, and maybe even borrow a few good ideas from each other. So let's make the session as collaborative and insightful as possible. And if you brought snacks, you're already ahead of the game. So I'd like to begin by acknowledging that Born Ontario operates across lands stewarded by many Indigenous nations. As a white settler and guest, I honor the knowledge keepers and leaders, past, present, and future, who continue to shape these lands. With September 30th marking the National Day for Truth and Reconciliation, we reflect on the legacy of colonialism and a responsibility to take meaningful action. At Born, reconciliation isn't a checkbox, it's a journey. We're committed to cultural safety and Indigenous self-determination through initiatives like SANIAS training, our Indigenous wellness team, and our ever-evolving Indigenous data governance policy. We uphold Indigenous data principles like OCAP, OCAS, CARE, and those in the National Inuit Strategy on Research, ensuring data empowers communities and supports culturally safe care for Indigenous birthing families. On the screen, you'll see a map from nativeland.ca, and this shows the diverse Indigenous territories across Ontario. It's a visual reminder of the deep histories and relationships that continue today. And a bit later, I'll share a QR code for a new fact sheet that was developed by PCMCH and the Indigenous Primary Healthcare Council. It's been translated into Cree, Inuktitut, Ojibwe, and Mohawk, and this supports Indigenous families across the province. So to bring everybody up to speed, last year, the Ministry of Health tapped Born to help track RSV doses across Ontario. So we rolled up our sleeves and updated our data collection to support the expanded infant RSV prevention program. After chatting with many partners, including the ministry, we added new data elements and officially launched data collection on October 31st, 2024. Yes, Halloween, but there were no tricks, just data. We focused on infant doses given at hospital births or deliveries attended by midwives. The prenatal doses were optional since they were usually handled in primary care and weren't the priority for protection. Now, a quick note on midwives. Some had medical directives to administer the infant doses, but others didn't, and we'll dig a little bit into those details shortly. So let's look back at the data to see how we did. Recent studies, including data from Quebec and Europe, show that Nirsevimab is impressively effective. In Quebec, it reduced emergency room visits, hospitalizations, and ICU admissions by 86%, 89%, and 88% respectively, which is not bad for a single dose. To put it another way, during the 2024-25 RSV season, immunizing just 41 to 57 newborns at birth prevented one hospitalization. That's a much lower number than many other immunization programs, some of which need 10 times the coverage to see similar results. So how did Ontario do in 2024-25? Well, almost 70% of infants received Nirsevimab before hospital discharge. Of the doses not given, 31% were declined by parents or caregivers, and it was usually because they wanted more information first. We also saw a wide variation across hospitals, from 32% uptake in some to 90% in others. This data covers births from all across Ontario hospitals, which accounts for about 94% of births in the province. So yeah, it's a pretty solid snapshot. So let's talk about Abrysvo, the prenatal RSV vaccine. While it is available, the Ministry of Health, in line with NACI, recommends Beyfortus as the preferred option for protecting infants. So no need to double up. Getting both isn't generally advised. Born does collect Abrysvo data, but it is optional. Last season, 6.2% of birthing individuals received it. However, since many doses are given outside of the hospital, we did see missing data for about 33% of the births. When we combine infant and prenatal doses, roughly 73% of newborns were protected against RSV, which is so encouraging. But it is likely an underestimate since out-of-hospital midwifery births weren't included in this analysis. Midwives did enter the immunization status when known, but it wasn't included in this analysis because it wasn't within their provincial scope. And a quick note on health equity, we're still working on that lens. Born, PHO, and ISIS are exploring factors like rurality, newcomer status, early prenatal care, and age at birth. We're also engaging with equity and public health groups to thoughtfully consider how we might approach race-related analysis. So there's more to come. Stay tuned for that. For our first season, the uptake we achieved was impressive, but the wide variation across hospitals show that there's still plenty to learn and share. So to better understand what worked and what didn't, Born ran a survey in June 2025 across all birthing hospitals. We heard back from 91 people at 54 hospitals, which is about 60% of the hospitals in Ontario. We asked, how did your team plan and deliver the RSV program? What went well? What were the challenges? And how did you use Born data to support your efforts? Today, we'll share some key insights from that survey so you can take what's useful and apply it to your own context as we head into the 2025-26 RSV season. Think of it as a bit of crowdsourced wisdom from across Ontario. One big message from the survey, hospitals had very little time or resources to prepare. And yet you made it happen. That is no small feat. Well done. Despite the tight timelines, teams across the province pulled off some impressive work. You partnered across departments, updated workflows and policies, engaged families, and invested serious time into staff education and training. In short, you got creative, you got collaborative, and you got it done. Yeah, I see some claps. Go ahead and pat yourself on the back. So what actually worked? There wasn't a one-size-fits-all approach, but the survey gave us some solid clues. First, hospitals that used more strategies saw better uptake. So yes, a multi-pronged approach matters. Second, certain strategies stood out. So things like forming a working group, assigning a lead, assessing readiness, educating staff, adjusting roles, and planning for monitoring and evaluation, all linked to higher uptake. In short, thoughtful planning and teamwork made a real difference. So as we saw earlier, monitoring RSV data is key to improving uptake, and this is really where Born can support your efforts. Our survey showed that just over half of respondents accessed the RSV prevention report in the Born information system, and nearly everyone found it helpful. I'll walk through the report shortly, so stay tuned. We heard great examples of how it's being used. Things like tracking uptake, comparing to provincial rates, identifying missed doses to target improvements, motivating staff by showing impact, and even sharing results with the broader community. It's a strong start, and we hope even more teams will use Born data this season to support and strengthen their RSV program rollout. So we know you've been working hard to prep for this RSV season. And based on survey feedback, here are a few key tips to keep in mind, which I'm sure many of you are already doing. Form a core team. Have a working group and a designated lead to clarify roles, especially around monitoring and sharing Born RSV data. Spot the barriers early. Whether it's workflow hiccups or staff unsure where to chart RSV data in the electronic health record, identifying challenges upfront helps tailor solutions. Keep education going. Stay current with resources from the Ministry of Health, PCMCH, and the Center for Effective Practice. And remember, Born is here to support your learning around RSV data and reports. Plan for monitoring. Use your Born RSV report to track progress, find areas for improvement, and celebrate wins with your team. Up next, we'll walk through how to improve your Born RSV data and use the reports to boost program delivery and uptake. Looking a bit more broadly, yes, we did get some great recommendations from the survey about the Provincial RSV program. You may have seen them already in the webinar invite, and if not, don't worry, we've got you covered. The feedback touches on everything from communications and resources to partnering tips, staff training, and how to monitor and share data effectively. After today's webinar, we'll be sending out a follow-up package to everyone who registered. It'll be complete with the infographics that are here and that I've mentioned, just in case they get buried under some meeting invites and some ministry memos. So how are teams using RSV data? Well, it's one thing for us to suggest ways to use Born data, but it's much more powerful to hear from a site that's actually doing it. Audra Borson, Manager of Patient Care in the Maternal Child Unit at Huron Perth Healthcare Alliance, has generously offered to share how her team used Born RSV data last season. So I'll now turn it over to Audra to present their Born RSV data. Go ahead, Audra.
Hi, thank you, Dana. Thank you, Dana and Born Ontario, for inviting me to share how I use the biz to access the data I need to help her every day and to make sure we have quality data in Born. Yeah, so everyone was in the same boat last year. Information was coming in fast and furious. We were all developing documentation, medical directive tools, and things like that. We are an uploading site, so we needed to implement a lot of change in our HIS in order to be able to have that data move across and engage our IT people. So I think we did a pretty good job with our uptake. You can see with the first graph, I'm looking right now at data for the whole season, so from November till the end of March. And we were above the provincial numbers, which I'm proud of. But we did have some changing uptake and stats, but I think part of it was we were going on, our team was undergoing a lot of change with a lot of pregnancy leaves and new hires and orientation as well. And with our model of care for the staff that were actually responsible for looking after administering the RSV immunization, that was a new practice for them too. So it was that whole learning about immunization itself, but also getting that comfort level to administer the injection. And so there was a bit of a learning curve, but I think on the whole, we did fairly well. And then, yeah, I would utilize this tool to look at opportunity and re-educate the team, which I'll chat about a little bit later. And then on the right side, you can see we just talked about risk, identifying some high risk. And based on our level of care here, we're a level 2. We didn't see a lot of high risk babies here, which is great for our team. But you can see out of 461 deliveries or babies between that November to March timeframe, only one baby was identified at risk. This particular slide is just sharing data on reasons not given. So again, this helped us here at HPHA to identify, again, I think opportunities for learning. I think, answering or documenting correctly or omitting documentation and following up and doing auditing of the charts. But you can see there was various, we had a very small amount born out of season because we were tracking respiratory season. A high number declined, which tells me we need to potentially ramp up our education throughout our patient's journey. I've tried to encourage the team lessons learned this year is that when our patients we should start educating our patients at the antenatal level and then during their laboring process. So you can see the different reasons that were documented and some stuff just based on learning. We've ramped up our education this year and done a lot more huddling and sharing of information and posting more data. So we should see less other or unknowns. So it's not always ideal to document that. And then on the right side, you can see our moms who had received a Breezvo antenatally, and we at HPHA had actually our organization focused on the newborn. So we had very small number of women who received it antenatally. But you can see based on our numbers there, we're maybe a little bit lower than some of our provincial partners there. Or we're a little higher, sorry, I was looking at the wrong number. But yeah, I use the RSV prevention program report right now as a great audit tool. So I kind of keep an eye on acknowledging the data as it comes in and looking at this particular report to see how we're doing and how we're doing against other like hospitals in Ontario. And then it gives us an opportunity to revisit during huddle or ramp up our education. Again, if there's missed documentation, it's where are we finding misses this year based on lessons learned last year. I've made some changes to our documentation where staff actually can't file documentation without required fields being filled out. So we should see a lot less omitted data this year. And then again, just identifying missing data on both sides. And so what I was able to do internally was work with our pharmacy team to pull together an RSV immunization administrative report. And so I take that data and I do chart reviews and monitor the biz to make sure both platforms, our HIS and the biz platform, has all the data it needs so that we can reflect back in situations like these where we can share data and look at, I would say, how well we're doing across the province with supporting this RSV initiative. I worked with our IPAC team to pull together some stats for this webinar, and they weren't able to pull together immunized versus non-immunized patients for us, but you can see that just at a glance, looking at 23, 24, and 24, 25, we almost had 50% less diagnosed RSV patients admitted to hospital. And what I like about looking at this particular data and with information on the biz from monthly data is you can really identify respiratory illness season. You can really see where we can see the trending, where, we may see higher numbers of pediatric admissions, which helps us to, perhaps change our staffing model based on operational needs. So December, a little bit in January, a little bit more in January last year, but on the whole, I feel like the immunization had helped. So that immunization was perfect.
And I think that's it for your slides, Audra.
Thank you. Is there, Dana, was there anything from yesterday that you had shared when I wasn't able to present? Is there anything you would like me to focus on based on our slides? I can answer some questions at the end as well.
Yeah, no, that's it. I think, yeah, just if you want to hang out in case anybody else has any questions for you and comparing notes or anything like that. Thanks so much again, Audra, for presenting this. This is so fabulous to see the data in action. So thank you so much for that. Okay, so switching gears now to a public health view for those from public health attending this webinar, or for others who may just be curious about how the data flows beyond the hospital walls. This slide highlights how public health units can access RSV immunization data through the Born Cube. This is a powerful reporting tool that provides insights into both prenatal doses and infant doses. And one of the key strengths of the Cube is that public health units can view data for residents of their own public health unit, regardless of where the birth occurred across Ontario. So for example, if baby Smith was born in Toronto but lives in Hamilton, Hamilton's public health services will still see that data. So there's no babies left behind. And this really helps public health units to monitor uptake of RSV immunization locally. It identifies gaps or trends in coverage and supports the targeted outreach and education efforts. It's another great example of how centralized data can support localized action and ultimately improve outcomes for infants across the province. So now let's walk through how you can access and use your hospital's RSV report to support your internal quality improvement work. Just a quick note that these reports are currently available for hospital use only. We don't yet have dedicated RSV reports for public health units or for midwifery practice groups, but it's definitely on our radar. We're hoping to expand our RSV reporting tools in the future, so stay tuned for that. In the meantime, if you're in a hospital setting, you've got access to some really great and powerful data, and I'll show you exactly how to find it and put it to work. The Born RSV report includes key data points to help hospitals monitor RSV protection for infants and pregnant individuals. You'll find frequencies and percentages for infant immunizations, high-risk infant data and reasons for risk, reasons immunization wasn't given, flags for missing data, and prenatal vaccine administration and timing. It's been developed to support hospital monitoring of the RSV prevention program and includes both hospital-level rates and a provincial comparator. Now, an important clarification, the report reflects provincial RSV immunization uptake for infants born at your site, not the number of doses administered locally. So it's not a performance scorecard, but a tool to support system-wide monitoring of RSV coverage across Ontario. It will also highlight how many infants at your site did not receive the immunization at all, which can be a great starting point for quality improvement discussions. And now let's look at where to find it. So let's get into the how-to part, accessing your RSV report in the Born Information System, or BIS. So step one, log in with your username and password. If your login is giving you grief, don't worry. Your local admin or your friendly Born regional coordinator can help you get sorted. Once you're in, head to the Reports tab on the main screen. Here's a quick tip that if you don't see it, that's your cue to reach out to your local admin for access. You can either click directly on the word Reports or hover over it to reveal a very satisfying orange drop-down menu. From there, you'd select Clinical Reports, and that's where the RSV magic lives. So once you're in the Clinical Report section, you're almost there. Scroll down until you find the RSV Prevention Program Report. It's like finding the good snacks in the staff room fridge. You just have to know where to look. Sometimes there's a little cubby. So next, choose your preferred start and end month and year. This lets you customize the time frame you want to review. Then click View Report on the right-hand side here. And voila, your RSV data is ready to go. This report gives you a clear snapshot of RSV immunization coverage at your site, and it's a great starting point for quality improvement conversations. If you're running into issues accessing your RSV report and your local admin is not able to help, don't worry, you've got backup. You can reach out to your Born regional coordinator for support. Not sure who that is or how to contact them? Well, just head over to the coordinator team page on the brand new Born website as of October 7th in the About Us section. There you can find a vertical drop-down labeled Coordinators, where you can find who supports your hospital or MPG. So let's take a peek at the first tab. This is one of the most useful ones in the RSV report. You probably recognize this from what Audra presented. This tab gives you your hospital's RSV data side by side with Ontario's provincial numbers. So this obviously looks familiar to what Audra showed, and it's just as satisfying for your own sites. So again, the gray line would be your site's data right here, and then the orange line is Ontario as the comparator. Here's the really cool part. See these blue numbers down here? They're clickable, all of these blue numbers here. And when you click them, you'll get a list of patient MRNs, allowing you to dig deeper into individual level data if needed. It's like zooming in from the big picture to the fine details. I won't go through all 6 tabs today because we'd need snacks for that, but this one is a great starting point for understanding your site's RSV coverage. This tab, this is the third tab, which gives you insight into why the infants didn't receive the RSV immunization. And it does so with a colorful graph and a handy data table underneath. So this is the colorful graph, and then it would appear, this data table actually appears underneath the colored graph. And you'll see your site's data side by side with Ontario's. So this would be your site data here on the left, and then Ontario here, and then the same here, site, and then Ontario. This makes it easy to spot trends. So in this example, the most common reason at this site is, again, like we saw with Audra's presentation, is the parent guardian declined. So this is a good reminder that education and communication are key. You'll also notice a fair bit of unknown data down here. If it's not too small for you, it's 27.3, but there's not much missing data. There's actually none here to show. There's no number. And that's actually a really good sign. It means staff at this site are entering unknown when the reason isn't clear, rather than skipping the field entirely. So just to clarify, when we say unknown, it means that you've entered a reason that's not clear. And when we talk about missing data, well, that's data that wasn't entered at all. Other tabs in the report show data on high-risk infants, prenatal vaccine uptake, and missing data, which is all useful for identifying gaps and planning improvements. So now let's go through some tips for improving your born RSV data. Just a note that there are no changes to Born's RSV data collection this season. We're keeping things consistent while we gather a second year of data. This info is here to support data entry and clarify some common questions that we've heard. If your site uses manual entry, share these visuals with staff. If you use an electronic health record, make sure nurses and midwives know where to chart their RSV data in the chart. A note on entering data: complete data is key. Missing or unknown entries can skew uptake stats. The infant RSV data, for the most part, is mandatory. And this means you have to enter or submit an answer to these questions, or the data won't come across to Born. They are essential for tracking RSV dose uptake, reporting to key partners like the Ministry of Health, ICIS, Public Health Ontario, researchers, and several others. It supports province-wide surveillance and coverage, and centralizes the RSV protection info for future sharing with clinicians in the circle of care. We're not asking for this data to be difficult. We're asking because it's essential. This data helps ensure infants receive the protection they need. It fuels research, it informs policy, and improves care for the most vulnerable population, our little tiny newborns. So let's look at some tips for improving your born RSV data. In the postpartum child and NICU encounters, this is what the RSV data looks like for a manual data entry folks. If you enter data via your electronic medical record or electronic health record, make sure you are familiar with the location of these data elements in your chart. So here we have, hopefully it's big enough for everybody, RSV monoclonal antibody administered, and then there's a yes, no, and unknown options. If the answer is yes, then the date would pop up. If you know it, you'd fill that in, and if you don't, there's a little unknown checkbox underneath. The product will also come up, and so here we have Beyfortus, no doses specified, 50 milligrams, 100 milligrams, and other, and this is only if a new product is used. And then, of course, we have unknown. If you're not sure of the dose, select no dosage specified. And just for some clarity, Beyfortus is the same as Nirsevimab. It's the same product, it's just a trade versus generic name. Currently, Beyfortus is the only approved product, so you would only, like I said, use other if something new comes along. So no surprises this season, just a continued focus on clean, complete data. If no is selected, so this is the same data we have here, but no has been selected, so this is what it looks like. You'll need to choose a reason why it was not given. This helps track missed opportunities and improve care. Since doses are meant to be given before discharge, it's important to capture why it wasn't given. The current list isn't exhaustive. We are holding off on adding more options until we've collected a second season of data. A helpful question to ask here is, was the immunization offered? If not, select not offered before discharge, which is right here. If yes, then choose the most appropriate reason from the list, which I'll go through on the next slide. And again, just remember, unknown means the reason was unclear. And when we say missing, that means that data wasn't entered at all. So let's keep the data clean and complete. It really makes a big difference. So let's go through the data entry options in the Born information system for why the monoclonal antibody might not have been given. Infant born out of season. Use this when babies arrive between April and September outside of the RSV season. Parents or guardians declined. Any form of no thanks counts, whether it's a refusal, a delay, or a plan to get it elsewhere, or just needing some more information. If they didn't say yes at your site, it's a decline. Prenatal RSV vaccine greater than 2 weeks before birth and the infant is not high risk. If the mom or pregnant person got the shot more than 2 weeks before the delivery of the baby and the baby is not high risk, they're covered. If it's less than 2 weeks, then the baby still will need protection. No supply available. No stock, no shot. Whether it's a pharmacy closure or supply hiccup, if you couldn't access it, this is your pick option. Not offered before discharge or missed opportunity. If the baby left without the offer because of like an early discharge, missed consent, etc., you'd pick this option. But don't use it for transfers to another NICU due to illness or because they were too small. Out of hospital birth or midwives not authorized to administer. We do know that midwives were not authorized to administer it, but we do know that there are some regulatory changes on the horizon. So stay tuned. We'll remove this when those changes occur. Confirmed RSV infection. If the infant is admitted to your unit with a known RSV infection, the antibody isn't needed. We know that this is rare, but it's still an important flag. Other specify, so use this only when nothing else fits. Some examples of this could be the infant was too sick, the infant was transferred after consent, stillbirth, dose given before arrival, but please avoid using other if another option fits. Misuse of this affects data quality and reporting accuracy. And then, of course, we have the common unknown. It's simple. If you don't know, then just tell us. No explanation needed. So the last infant data piece for RSV is infant high risk for RSV, meaning they would need a second season dose. This field will help us flag infants who might need a second RSV dose next season. It's rare, but it's crucial. Early identification means better follow-up with primary care and public health and fewer missed preventions. It's the one optional infant RSV data element. And so for clarity, optional means you are not forced to answer it, but if you know the answer, please enter that data. It's still so crucial to the RSV Provincial Protection Program so that we can improve the care and outcomes that result from the data that you give us. Who to include? So only include infants from the postpartum and NICU units. Skip outpatient or other hospital areas. What to watch for? Some high-risk babies, like those with Down syndrome, may be spotted in the postpartum units without NICU care. Others might bounce back from NICU to postpartum. If they don't fit the usual boxes but still raise concern, this is where you can use other to help shape future criteria. So why does this matter? Even though these cases are few, capturing them now prevents missed opportunities later. No here is listed at the very top to make selection quick where applicable. And so looking at the big picture, this is not a final diagnosis. It's a snapshot of known risks at birth. Some conditions will emerge later, but think of this as planting a flag for public health to follow up and protect vulnerable infants down the road. I won't be going through the whole list of high-risk variables, but only the ones where we heard that there were some questions and concerns. So we have no, this is the infant is not considered high risk and does not meet the criteria in this list. Most infants won't meet high risk criteria, So no is listed again first to make data entry fast and easy. Yes, suspected or confirmed Down syndrome or trisomy 21. This is the most likely yes you will see in postpartum units. Even though the numbers are going to be small, tracking these infants ensures they get their second season dose, whether in hospital or out in the community. And then we have a yes for other reasons for second season or subsequent doses. So use this only when the reason does not fit the listed criteria. An important note that prematurity alone no longer qualifies as a high-risk variable under the current ministry guidance, so don't enter it here. Now I'm going to switch gears a little bit to the maternal data, specifically the prenatal RSV vaccine. This is for manual data entry, again, into the Born information system, so make sure your electronic health record charting team knows where to record it. So again, we have very similar to the infant data, prenatal RSV vaccine administered with the options of yes, no, and unknown. This tells us if the vaccine was given during the pregnancy. This is optional. Many doses are given outside of the hospital. So if the pregnant person isn't sure or can't remember, you would just select unknown here. If no or unknown is selected, there's no further RSV data to be entered. You would move on to the next section for your data entry. If yes, like it is here, you would enter the date. So again, similar to the infant side of things, you'd enter the date if you know it, and if you don't know it, then you can check this unknown checkbox that's below it. We ask about the product, and again, we have Abrysvo, other, only if a new vaccine is used, and unknown. And again, very similar to Beyfortus, that Abrysvo is currently the only approved product, so other is just there in case something new pops up. These next two slides highlight a few go-to resources, but they're really just the tip of the iceberg. You'll find RSV eligibility information on the Ministry of Health website, clinical guidance from sick kids, and likely some great tools within your own local network. There are resources for both providers and patients, so feel free to use and share whatever fits your needs. And yes, we'll send this presentation to everyone who registered, so you don't need to start scribbling notes at lightning speed. You'll have it handy to revisit whenever you need a refresher or want to dig deeper. So PCMCH is pleased to share updated fact sheets to support parents, caregivers, and healthcare providers with the essential information about the RSV virus and immunization options, which is aligned with Ontario's expanded RSV prevention program. The fact sheet for healthcare providers summarizes Ontario's RSV program, real-world effectiveness data, and guidance on administering Beyfortus and Abrysvo. It supports providers in answering questions from parents and expected parents. There's a fact sheet for parents and expected parents, and this provides practical tips to protect infants and high-risk children and supports informed decision-making. Providers are encouraged to share this resource with patients and families. And if you have your phone handy, you can take a picture of this QR code and scan it to download the fact sheet, or you can visit PCMCH website. I'll give you a couple of more seconds to do so, and then we'll move on. So if you're looking for more information tailored to your practice, the Association of Ontario Midwives has an RSV hub with updates on midwife drug regulations and guidance for administering doses in community settings. If you need answers to specific questions, the Centre for Effective Practice has a practical toolkit that covers key details about Ontario's RSV prevention program for infants in the 2025-2026 season. Thank you so much for joining us today. We'll be sending out a follow-up package to everyone who registered. It will include a copy of this PowerPoint, the infographics that I mentioned, summarizing the survey results, and it will also have a short evaluation survey, and I promise it is going to be quick. If you missed something or want to revisit something from this webinar, it was recorded, and it will be posted on our website for on-demand viewing. Like I mentioned earlier, in case you missed it, Born is going to be launching our brand new website on October 7th, and all information on RSV will be under the Initiatives drop-down tab. So now let's open the floor. If you have questions, we'd love to hear them. And if you've got strategies that worked well at your site last season, please share. We'll turn off the recording now, but we're going to collect and share any tips or ideas that come up in the information package. So let me just get to turning off the recording.